Today we're talking about omeprazole, one of the most commonly used medications for acid-related problems. Omeprazole belongs to a group of medicines called proton pump inhibitors, or PPIs. These medicines reduce the amount of acid your stomach produces. Your stomach has tiny acid-producing pumps called proton pumps. Their job is to release acid that helps you digest food. When you take omeprazole, it travels through your bloodstream and reaches these pumps. And here's the key part: omeprazole switches these acid pumps off. Not just a little, it blocks them strongly and for many hours. When less acid is produced, heartburn reduces, reflux symptoms ease, irritated tissues in the esophagus can heal, and stomach and duodenal ulcers can heal because they're no longer exposed to strong acid. That's why PPIs are often used for conditions like acid reflux, GERD, indigestion, stomach ulcers, gastritis, esophagitis, and H. pylori treatment. One important point: omeprazole doesn't work straight away. It usually takes 2 to 3 days to reach full effect. That's because it only blocks the acid pumps that are active at the time you take it. Your body creates new pumps over time, so the effect builds gradually. Even though the medication leaves your body fairly quickly, the acid pumps it switched off stay off for 24-48 hours. That's why one daily dose is usually enough. Omeprazole is generally well tolerated, but like all medicines, it's not suitable for everyone. If symptoms persist, worsen, or you need it long-term, always speak to a healthcare professional for personalized advice. Now let's talk about long-term use. When it's taken for long periods, there are a few things healthcare professionals keep an eye on. These can include reduced absorption of certain nutrients like vitamin B12, magnesium, iron, and calcium. This doesn't happen to everyone, but it's something doctors monitor. Also, a higher risk of certain gut infections, since stomach acid is one of your body's natural defenses. Some people experience temporary increased acid when they stop a PPI suddenly. Some studies also suggest a small increased risk of fractures in people on high doses for long periods. This doesn't mean omeprazole is unsafe. It's a very effective and widely used medicine. But like all long-term treatments, it should be reviewed regularly to make sure it's still needed. If you found this helpful, follow for more pharmacist-explained medicines and health breakdowns.